the cruise terminal and some possible infection, and then all of a sudden we know that within a week COVID was the topic of discussion all across the city and the state and the county. We soon, of course, began a shutdown process, as did the entire county of Los Angeles and pretty soon the entire state of California. We know that the economic shutdown that happened here locally and across the country was also a significant economic impact to us as a community, as a city, and also as a state. We know that that shutdown also saved countless lives. We have seen all of the data that has shown that even just delaying those closings a day, two, or longer would have cost this country and this city thousands, in the case of the country, thousands of lives, and certainly here locally it would have cost us lives as well as across the state. And so we put public health first, as we always should. We also know that COVID has caused a huge economic impact, one that will be with us for years. Unemployment, of course, has gone up. Businesses had to close down as we focus on protecting the vulnerable, our seniors, and those who needed our support. When businesses are closed, we know revenue goes down, sales tax doesn't come in, hotels and the revenue from hotels that go to cities essentially was eliminated. And so as a community, we've had to prepare and deal with how we're going to financially bounce back from what is not only the largest health crisis we've had, but now an economic one, and an economic position that we haven't been in since the recession or even prior to that, where at one point our unemployment rate during the recession was almost at 15%. Now, before COVID, the city had lowered that, and we were anywhere between 4.7, 4.8% unemployment, depending on the month. And so things were, of course, as a community, were strong. And we expect to bounce back, hopefully, in a way that will be strong as well. And so what we did, of course, is got to work and made sure that we had the resources to take this on. As a reminder, what we've been doing as a community is also costly. We do 1,000 tests a day for free, whether you're insured or uninsured, whether you are documented or not. We put up a clinic to provide medical health care, again for free, whether people had insurance or not. We have deployed resources into our health department. We put out grants for small businesses. We've done everything we can to support the community, and we'll continue to do that work. But that, of course, comes at a cost. And so, like every budget at the city or at the state, we're going to have to make hard choices in the weeks and months ahead. But there is some good news. And thanks to really great work by our city team, our strong relationships both in Sacramento with the county, we've been able to work to secure funding for Long Beach to ensure that we're able to pay back these costs and these health costs and hopefully be able to provide programs for the community. Let me start with the state of California. We early on reached out to Governor Newsom and shared that because of the size of our city, which was just shy of 500,000, we had been left out of the federal CARES Act, and so we asked for direct funding for CARES Act money in his budget. I'm proud to say that Long Beach is the largest city in the state to receive direct CARES Act funding in the budget proposal that is in front for a vote this week. We expect that Long Beach could receive in this budget approximately $40.5 million in this budget, as proposed by Governor Newsom. And I want to thank Governor Newsom directly for working with me and our team on this package for our city. Now, we know, of course, that it's still up to the legislature to pass the final version of this budget, which should happen at the end of this week. But we're grateful that the Department of Finance has worked with us to include this significant amount of CARES funding for the city of Long Beach. This funding we will put to good use, of course, to pay for the tests that are in the field, for services for our community that has been affected by COVID-19, critical health department needs around COVID, as well as programs that we're going to put in place over the next few weeks and months ahead to ensure that the economic impact that we are feeling will be dealt with in a way that's supportive of the community and that centers public health. And I want to thank the entire team for doing this. This was not hard to get done. This was hard to get done, but the governor and his staff have been fantastic. In addition to the $40.5 million that we hope to see from the state and signed into law here in just a few days, we also directly went out to the County of Los Angeles and asked them for direct funding from some of their CARES Act relief money, knowing that Long Beach needed support from both the state and the county. I am happy to say that we've received an initial $13 million from the Department of Public Health, LA County. That $13 million will also be going to this health pandemic. And I personally want to thank Supervisor Janice Hahn, who partnered with me on ensuring that we received those funds. We also expect the county to continue to partner with us on other resources and other funds to even bring more money into Long Beach. What does that mean for Long Beach? We're looking that it is quite possible that by the end of this week, Long Beach will have advocated and fought for and received almost $54 million in state and county resources to help address this COVID crisis. That will be a significant support for our city's budget, for our health needs, and to ensure that we keep our community safe. So again, I'm thankful to everyone that worked on this, and let's hope that those numbers stay at that level by the end of the week, and we're working with all of our legislators and our legislative team to make it happen. In addition to that, so I wanted to talk about the budget. That's really great news for Long Beach. Let's talk about where we're at with the reopening process. We know that this past weekend, Long Beach reopened some additional services. We expanded our funeral and weddings and their capacity to do those events, and we're grateful to those. And more broadly, we know that bars and wineries, brew pubs, and nail salons reopened. And most, by the way, reopened safely and with all the physical distancing protocols, the reduced capacity, the face shields and masks, and others. Let me just also add that this upcoming Friday, like we mentioned last week, we will be reopening some additional industries that include massages, facials and lashes, esthetician work, tattoo parlors. So the other personal care grooming will begin to allow to reopen this Friday with the safety modifications as we announced last week. We're not reopening, even though it's allowed by the state, or movie theaters and other family fun centers. Let me note that while our numbers have generally been stable, and you're seeing certainly some alarming statistics statewide, the city of Long Beach has been the most cautious public agency in our reopening in the entire region. And so as we talk about what we're doing today, and you think about where the County of Los Angeles is, the City of Los Angeles, Orange County, even beyond that to other neighboring counties across Southern California, we have implemented the most cautious schedule. Many of the industries that are going to open in Long Beach on Friday are already open all across Southern California. And while we know that's been hard on small businesses, I will also say it's been the safe and right thing to do for our community to make sure that we are being cautious, because we know that COVID-19 is still taking the lives of our most vulnerable every single day. And just having an additional week gives us an opportunity to look at more data and flatten out and create that space in our hospitals so that if anyone in your family gets sick, that there's a hospital bed waiting for them to take care of them with the team ready, with the capacity that they need. And so I want to thank you for your patience and for supporting your city in this process. Let me also turn to our open street projects. Our Open Street Initiative has launched. We have streets opening up across the city, on-street parking, parking lots, plazas, promenades. Just in Belmont Shore alone this weekend, 12 parklets opened up all up and down the street this last weekend. So restaurants are coming back with being able to actually implement open street and into the sidewalks, into the street, so that they can have the capacity they need to run their restaurants. And there are many more plazas, many more parklets moving forward. And so thank you to everyone participating in that and in that program. And to conclude on two final things, we also did enforcement this weekend. Our enforcement team went out to 52 businesses this last weekend. That included 17 bars and 9 nail salons. The remaining were a combination of retail and barbershops and markets. And so they went out, of course, with an education-first approach. A couple citations notices were given, but most of those were educational visits, just to ensure that people were complying and to give folks an opportunity to comply with the new rules. We want these businesses to be successful and to continue their reopening process. As a reminder, if you believe there's a violation of the health order, you can call 562-570-2633, or you can visit longbeach.gov/LBDS. That's Long Beach Development Services, LBDS. On the COVID site, there should also be a link as well on the COVID-19 page in Long Beach. And then lastly, we had another food distribution this weekend. We distributed 182,000 pounds of food. That's over 150,000 meals. We want to thank the health department, the 100 volunteers who helped out on Saturday, and our partners at the LA Regional Food Bank for just an amazing event. We have another food bank project coming up in the next couple of weeks, and we'll announce that as we move forward. And so a lot of good work happening with COVID-19. We know that our framework listening sessions, which began late last week, will continue, and I want to thank everyone for participating in those. And with that, I'm going to turn this over to Dr. Davis. Thank you.
Thank you, Mayor. Good afternoon. As we continue to open up our economy and more businesses are welcoming customers, it's important that our older adult populations, those who are 65 and older, and anyone who has serious underlying health conditions take the proper precautions when heading out of their homes. Because we know that both of these groups are at a higher risk for developing more serious complications from COVID-19, and both of these groups are most likely to be hospitalized and have worse outcomes due to their infection with COVID-19. So I'd like to share with you a few practical tips for older adults or those with underlying health conditions, but anyone can use these tips to lower their risk as they're going out, to protect themselves when they're leaving their residence. And while I'm giving these tips of what to do if you do leave your residence, I just want to emphasize that older adults and those with underlying health conditions should limit their trips to what's absolutely necessary. So while these tips may seem simple, it's helpful that we just say them out loud and remind ourselves what are the best things we can do to prevent exposure to COVID-19, to prevent ourselves from being around someone else who might be infected. And of course, during all of these trips, it's very important to wear a face covering. So for grocery shopping, try and order food and other items online for home delivery or curbside pickup. When you do have to visit in person, try to go when there's less people there. So for example, early morning or late night. Or find out if the store has special hours for those at higher risk. Many stores do. Disinfect your shopping cart if you can. If possible, use touchless payment. After leaving the store, use a hand sanitizer, and when you get home, wash your hands with soap and water for at least 20 seconds. For deliveries and takeout food, if possible, pay online or on the phone when you order. Ask for deliveries to be left in a safe spot outside your house with no person-to-person interaction. Otherwise, stay at least 6 feet away from the delivery person. And wear your face covering, and hopefully they'll be wearing one too. Wash your hands or use hand sanitizer after accepting deliveries or collecting mail from a post office or a home mailbox. For banking, use ATMs, mobile banking apps, or telephone meetings for routine transactions that don't require face-to-face assistance. When you get gas, try and use disinfecting wipes on the handles, or you can use hand sanitizer after you're done pumping your gas. And always remember to wash your hands when you get home. If you need to schedule a doctor's appointment or have other non-critical medical needs, first try and talk to your doctor or your healthcare clinician online or by phone or email. Talk to your doctor about rescheduling procedures that aren't urgently needed. Try to use touchless payment methods. Try to limit your in-person visits to the pharmacy. So plan to order and pick up all your prescriptions at the same time, and use drive-through windows, curbside services, mail order, or other delivery services. And you can even check with your doctor and pharmacist to see if you can get a larger supply of your medicine so you don't have to visit the pharmacy as often. While these tips are helpful, again, it's critical to remember that those at higher risk should not be going out extensively, and you're truly safer at home. So next, I'd like to just remind folks that while our Safer at Home health order is continuously being amended to allow more activities, right now social gatherings are not allowed under the current order. They're also not allowed under the current state order. Unfortunately, we have been receiving notifications of house parties and gatherings across the city, which right now are not allowed. It's important that we continue to follow the protocols of the order, especially as we approach the 4th of July weekend. Neighborhood parties and other social gatherings can quickly spread COVID-19 because people are spending a long period of time with other people who are not part of their household for long periods of time in close contact. And we know that the more closely you interact with others and the longer that interaction lasts, and the greater number of people outside of your household you're interacting with, the higher the risk of COVID-19 spreading. So please try and follow local and state guidelines the best you can. Not only are you protecting yourself and your family, you're protecting our larger community and those who have a higher risk of serious COVID-19 complications. Now I'd like to turn to employers who are requiring testing to return to work. We've been getting reports that some employers are requiring their employees to have 1 or 2 negative tests before they're able to return to work as part of the reopening. And I just want to say that a negative test just gives you a snapshot of what's occurring right at that moment of time. So it could be that you're still in your incubation period, and so your positive test is going to come in the next couple of days. Or it could be that you're negative at this moment in time, but tomorrow you're going to be exposed to somebody who has COVID-19, and then you're still back in that at-risk exposed category. So it somewhat uncovers, so when you get a test and you don't have symptoms, it somewhat can uncover what's already occurred. So it may be helpful if it catches an infection, but it doesn't give you a complete picture. So if all you do is test your employees, that will not be enough to keep COVID-19 out of the workplace. The most important thing employers should be doing is really being vigilant about having their employees wear face coverings, maintaining their physical distancing, staying home when they're sick, washing their hands, and disinfecting their workplace regularly. So in closing, one final announcement I'd like to make is that our COVID-19 info line has new hours. It's now open Monday through Friday from 9 to 5 p.m. The number remains the same at 562-570-4636, so 4636, which is info, 570-info. Thank you.
Okay, we'll go and do questions, and if there's questions for me first, and then Dr. Davis will switch.
Thank you, Mayor. The first question from the media is for Dr. Davis.
You go.
This one comes from Donna Littlejohn with the Southern California News Group. Personal threats have been received by several public health officials in recent weeks, including Dr. Barbara Ferrer, who said in a statement released today that she has received death threats. Have any Long Beach public health officials experienced anything similar? And if so, what is being done to address that?
So not that I know of. As far as I know, no public health official from Long Beach has received any death threats. I do want to say that I feel like all public health professionals, Dr. Farrar and everyone else throughout the state and the nation is really trying to provide the best recommendations to protect the public's health and decrease deaths from COVID-19. This virus has only been with us that we know of since December 31st, so 2019. So about 6 months now. And so there's a lot of new data, there's a lot of evolving information that comes out. And all public health professionals are really working tirelessly to translate this new and evolving data to recommendations that protect the public's health and decrease deaths. And I think it's really important to have open and frank discussions about the recommendations that we're making. I think all of us would welcome that. You know, what's the data supporting wearing a mask? What's the data supporting washing your hands? Why are you saying that? I think that that's really important and helps to move the conversation. But I don't think personal attacks do. So I feel like it's just distracting us from what we're really trying to do, which is minimize the transmission of this virus.
Thank you, Dr. Davis. We have a couple more questions for you from social media. If someone wants to have a wedding, can they? And what are the limitations?
So the orders around religious ceremonies or ceremonies such as weddings is also evolving. So right now, you can have a wedding. There are some limitations on the amount, the number of guests, which is predicated upon where you're having the wedding at. So I would just communicate with the venue where you're trying to have your wedding to have them let you know what the size limitation is. Right now, the wedding ceremony itself is allowed, but not receptions.
All right, thank you. One last question. What is being done to support and protect residents of long-term care facilities?
A lot is being done to support and protect residents of long-term care facilities. As everyone probably is aware by now, that is a very high-risk institution, and for both the residents and the staff. And so we continue at the City of Long Beach to work with the state and to work with our facilities to ensure that aggressive testing is occurring, to ensure that we rapidly identify those who are infected, and then we make sure that they're not infecting other people. And to really make sure that the right infection control practices are happening, so making sure that everyone is wearing a mask, that everyone's wearing the proper protective equipment, that they have enough protective equipment, and just making sure that they have enough staff. We help with that. So we're really just a liaison with the skilled nursing facilities and other long-term care facilities to make sure that the residents and the staff are safe and that they have what they need in order to continue to function at a high level.
Okay, thank you. Now we'll have a Spanish translation.
Muy buenas tardes, gracias por estar con nosotros esta tarde, lunes. Vamos a empezar con nuestros números. A partir de hoy, 3,042 residentes han salido positivos del coronavirus. Aproximadamente 2,359 se han recuperado. Y a partir de hoy hemos perdido a 120 residentes en la ciudad de Long Beach. Vamos a empezar también con un poco de información sobre los presupuestos en nuestra ciudad. Saben que desde que empezó esta pandemia y cerramos nuestra economía, Han visto muchos cambios y obviamente va a ser un trajín mucho más largo en muchos meses, posiblemente años para recuperarnos de esto. Y hoy el gobernador y la legislación estatal llegaron a un acuerdo, el presupuesto estatal del año fiscal de 2021. Esto incluye millones de fondos para las leyes CARES, el programa, y la respuesta de recuperación del coronavirus en la ciudad, el financiamiento directo para servicios para personas sin hogar que están críticos, especialmente en este momento. Queríamos agradecer al Condado de Los Ángeles, en particular, por todo, porque han luchado para que la ciudad de Long Beach también tenga de esta ayuda en nuestra respuesta de salud pública del coronavirus. El Condado de Los Ángeles, saben, como nuestra ciudad de Long Beach y la ciudad de Pasadena tenemos nuestro propio departamento de salud, están trabajando estrechamente en un enfoque regional en nuestra respuesta desde que comenzamos este pasado marzo de este año. También tuvimos este fin de semana una distribución de comida. La ciudad organizó un evento de distribución de alimentos en Cabrillo High School. En este evento distribuimos más de 150,000 comidas a los residentes. Agradecemos a nuestro personal del Departamento de Salud y a los 100 voluntarios que ayudaron el sábado y nuestros socios del Banco de Alimentos Regional de Los Ángeles por un gran evento. Sabemos y les platicamos un poco el jueves pasado que hay unas reaperturas de esta semana. Este pasado fin de semana abrimos más servicios en Long Beach que incluyeron lugares de culto, religión, iglesias, funerales, bares, bodegas y salones. Este jueves vamos a anunciar más detalles sobre lo que vendrá a continuación en términos de reaperturas. Hay una línea de base estatal con pautas para la reapertura y nuestro Departamento de Salud está revisando los números regularmente cada día para informarnos cuando es seguro reabrir sectores adicionales. Aunque nuestros números sí se han visto un poco estables en estas últimas semanas, la ciudad todavía no está completamente lista para reabrir y queremos asegurarnos que nuestro Departamento de Salud esté en cargo de esas decisiones. Un poquito de información sobre las calles, el programa de calle abiertas. También durante el fin de semana progresamos mucho con el programa de Open Streets. Aquí en Long Beach, la iniciativa Open Streets transforma temporalmente las áreas públicas en espacios seguros para actividades físicamente distanciadas. Los espacios que se han convertido en calles abiertas incluyen las banquetas o estacionamientos en las calles y plazas y paseos. Estamos trabajando para abrir varios más en toda la ciudad. Open Streets ayuda a dar a nuestros propietarios de pequeñas empresas y a la comunidad más espacio para interactuar mientras permanecen físicamente distanciados, lo cual es muy importante para mantener viva nuestra economía y para que la cultura de Long Beach prospere. También información sobre cómo seguir reabriendo y quedándonos más seguros y cuidando a nuestros adultos mayores. A medida que continuamos a abrir la economía y más empresas, es importante que nuestra población de adultos mayores y cualquier persona que tenga graves problemas de salud tomen las precauciones adecuadas cuando deciden salir de sus casas. Todavía recomendamos que las personas de mayor edad y personas con enfermedades crónicas se queden en su casa, pero si es que van a salir, la doctora Davis nos ha dado pocos consejos sobre cómo hacer esto. Estas personas que salen, por ejemplo, si van a salir a comprar sus mandados al mercado, pueden ordenar alimentos o artículos en línea, o también si lo ordenan en línea y recogerlo afuera. Cuando tenga que ir de compras en persona, es mejor averiguar primero si hay horarios especiales para personas que son mayores, o también si puede ir, nomás abren las tiendas o más cuando no están tan ocupadas, como un poco antes de que cierren las tiendas también. Desinfectar mucho es importante los carritos de donde hace sus compras. Si es posible, pagar en alguna manera sin contacto, y después de salir de la tienda desinfectarse las manos. Cuando llegue a casa, también lavarse las manos con jabón durante al menos 20 segundos. Para entregas de comida para llevar, cuando ordenan comida para llevar de algún restaurante, es posible que pague en línea o también cuando está poniendo su orden por teléfono, pida que les entreguen, le dejen en un lugar seguro afuera de su casa, donde no tenga que tener contacto con la persona que le está llevando su comida. Lávese las manos y desinféctese bien otra vez para aceptar o entregar o recoger el correo del buzón. Servicios del banco, es más recomendable que usen las máquinas automáticas afuera del banco en vez de entrar adentro, de tratar de evitar la manera de no tener que entrar al banco. Y cuando tiene que ponerle gasolina a su carro, use toallitas desinfectantes en los botones antes de tocarlos y use guantes desechables, pero recuerden que es muy importante tirarlos antes de meterse a su carro para no pasar los gérmenes a otros lados, a otras superficies. Y por supuesto, siempre desinfectarse antes y después. Si necesita programar alguna cita médica o cualquier cita que tenga, sea del dentista o de médica, es importante que traten la manera primero de ver si puede hacer una cita sobre el teléfono, sobre telehealth, que se pueda ver en la computadora con sus proveedores médicos cuando sea posible. Si es que tiene que pagar algún copay, es más importante tratar de manera sin contacto o sobre el teléfono. Intente limitar las visitas a la farmacia también. Puede planificar mejor y recoger todas sus recetas al mismo tiempo. Utilice las ventanas para llevar en los lugares así cuando pasan los automóviles, si es posible. Incluso también consultar con su médico para ver si puede obtener un suministro mayor de sus medicamentos para que no tenga que ir tanto a la farmacia o con tanta frecuencia. También es muy importante que las personas, les digo otra vez, recordarles que es más importante que las personas mayores se queden en sus casas. Unas responsabilidades personales que tenemos, recordamos que la orden de salud más segura en el hogar se ha seguido modificando, pero todavía está ahí y no se permiten actividades. Las reuniones sociales aún todavía no están permitidas en nuestra orden de salud. Desafortunadamente hemos estado recibiendo muchas notificaciones que han visto juntas de fiestas en casa, reuniones en toda la ciudad, y eso todavía no se permite. Es importante que sigamos los protocolos de la orden, especialmente que la próxima semana sí están las festividades del 4 de julio. Las fiestas con vecinos y otras reuniones sociales pueden propagar rápidamente otra ola del coronavirus. Porque entre más tiempo tomen con otras personas de otros hogares, puede traer otra ola del virus también. Sabemos que cuanto más interactúas con los demás y más dura la interacción, mayor será el riesgo de propagación del virus. Intentes seguir las pautas locales, estatales, lo mejor que pueda. Recuerden que no es solo protegiéndose a usted, sino que a sus familiares también. Y hemos también recibido alguna información sobre empleados que las compañías están requiriendo que antes de regresar a trabajo se tome una prueba del virus. Entonces queremos decirles que una prueba negativa solo le da instantánea lo que está ocurriendo en ese momento. Puede ver que todavía está incubando el virus y sea positivo en el próximo día o dos. Podría estar expuesto el día después de obtener sus resultados. Por lo tanto, que de alguna manera descubre lo que ya ocurrió, pero no le da una imagen completa. Si todo lo que están haciendo los empleadores y las compañías que están reabriendo es pedirle a sus empleados que sigan tomando pruebas del virus, no necesariamente, lo más importante es que hagan las precauciones adentro de estas empresas. Por ejemplo, asegurarse que todos usen máscaras para la cara, para cubrirse la cara, que todos estén lavando las manos, que si están enfermos no lleguen a trabajar y que sigan todas las recomendaciones que está dando la ciudad y el Departamento de Salud. Por último, queremos anunciarles que ha habido cambios en nuestra línea de información. Ahora solo estamos abiertas de lunes a viernes, de 9 de la mañana a 5, pero el número sigue siendo el mismo, que es 562-570-4636. Muchas gracias por acompañarnos hoy. Nos veremos a la misma hora el jueves 25 de junio. That is all the information we have for today. Thank you for joining us, and we'll see you guys on Thursday. Thank you.